welcome to our forum discussion with the topic anti-vaccines. Few measures in public health can compare with the impact of vaccines. Vaccinations have reduced disease, disability, and death from a variety of infectious diseases. For example, in the United States, children are recommended to be vaccinated against 16 diseases. Before we begin, let us first introduce our honorable panel. Would you like to start first, Kesan?
Sure. I'm Hamzimi, head of the researcher in the Hospital of University Kebangsaan Malaysia. I've been researching and testing new vaccine for the past 30 years.
Okay, good morning. I'm Dr. SYAHIRA, Malaysia Minister of Health, and I worked as a general practitioner at hospital for 10 years. Before joining the government, thank you for having me here today.
Thank you for you joining us today as well. Without further, let's begin our forum discussion today. There are two objectives that we are going to tackle today here in this forum. First, we want to understand the perspective from both pro-vaccine and anti-vaccine. Second, we would also like to know with the benefit or side effect the vaccines have. With that in mind, can you tell us a little bit about what is a vaccine?
Sure. Vaccine is a biological preparation to have stronger immunities against certain type of disease. It contains an agent that resembles a weakened or killed form of disease-causing microorganism. And by injecting the vaccine into the body, it stimulates the body's immune system to recognize, destroy, and remember the disease-causing microorganism for the future encounters.
Okay, what are the vaccines commonly used for?
Vaccine can be used to prevent against many types of disease. For example, smallpox, polio, measles, mumps, and rubella. In fact, the only human disease we eradicate, smallpox, for example, smallpox was eradicated using a vaccine. Another example is polio, which occurs thousands of it in the 20th century, is also near eradicated using vaccine.
Okay. Before that, I want to add some information. Vaccines not only provide individual protection for those persons who are vaccinated, they can also provide community protection by reducing the spread of disease within a population. Okay. Person-to-person infection is spread when a transmitting case comes in contact with a susceptible person. Do you know when did the vaccine movement start?
The notion of anti-vaccine started almost as early as when the vaccine was created. It started to gain traction when a British doctor, Andrew Wakefield, published a journal entitled The Lancet that linked the vaccine with causing autism in children. And later the theory was disputed, and Andrew Wakefield was stripped of his medical license for his unethical behavior and for his own profit.
Okay, that's right. After the publishers of the Lancet, the vaccination rate among children in the UK dropped significantly, and in a certain section of London, fewer than 50 of population were immunized.
It's often said that vaccines save lives, but this is not strictly true because it is vaccination that remains if the vial is 0% effective, even if it is the best vaccine in the world. Thus, it is imperative that we all work together to ensure that higher level of coverage is obtained among populations for whom vaccines are recommended. Would you think that people will have higher acceptance toward vaccination? But the fact of the matter is more and more people are beginning to reject the idea of vaccination. Why do you think that is?
Okay, it's not a simple matter of being educated or having more information. Contrary to that, research has shown the information contained there against vaccination can worsen vaccine hesitancy. Two potential powerful moral values that underlie people attitude and judgment are individually liberated and plurality. Liberty is correlated with belief in personal freedom, responsibility, and resistance to state involvement in citizen life. Concern about priority center on border rights and protection from
The recent rise of vaccine skepticism and outright refusal also led to cases where there are communities of unvaccinated children who are more susceptible to the disease. For example, in Minnesota's measles outbreak in the United States in spring, sickened 79 people and exposed 8,000 people to the disease. Including more than 500 people who were asked to stay home from school, childcare, and work because they were unvaccinated and at risk of contracting and spreading the disease.
Oh, I see. And I've heard to say that people make decisions about vaccination not only based on facts but on emotion as well.
Yes, you are right. We cannot make the assumption that people who refuse and anti-vaccine will simply accept the vaccination just because we told them the benefits of the vaccine. Personal beliefs and religious play an important role in it as well. Based on a survey done on the people of the United States, yes, you are right. We cannot make the assumption that people who are against vaccine before will simply accept vaccination just because we told them the benefits of the vaccination. Based on the survey on the people in the United States, the researchers found that the people who are more religious had low support towards vaccine science overall.
Is there a way to convince people who are against vaccination to accept it?
There is by incorporating the moral foundation of a person's health decision. For example, if a parent is against vaccination because he or she has a concern about the chemical in vaccine, the visitor or doctor can address the concern with the priority value in mind. So, concern with the instead of pure of vaccine chemical, we can change the perspective to pure of infection and disease and show a picture of child with misness to show the risk and danger are not being vaccinated.
Oh, that's brilliant. Shall we go at this from a different approach then? Let's answer some of the questions that I have received from the audience, shall we?
Sure.
First question, do you agree that disease had already begun to disappear before vaccines were introduced because of better hygiene or sanitation?
I have to disagree with that. Better nutrition, development of antibiotics, less crowded living conditions, and lower birth rates that contribute to the decrease of disease overall. Not to mention the improved socio-economic condition and definitely contribute to the decrease of disease as well. Since sanitation is not better now than it was in 1990, we cannot attribute to the decrease of disease to anything but the vaccine. For example, in Japan, around the time the vaccination rates dropped, the number of cases of pertussis jumped from 393 cases with zero deaths to in 1974 to 13,000 cases and around 41 deaths in 1979.
For a second question, is it true that the majority of people who get disease
It's true that in our outbreak, vaccinated people outnumber those who has not been vaccinated. The reason behind the paradox can be explained with two factors. The first factor is no vaccine in the 100% effective, and the second is those who have been vaccinated for outnumber those who have not. Depending on the individual, not at all vaccinated person develop immunity, and most childhood vaccines are effective for 85% to 95% of recipients.
There is common belief that there are hotspots of vaccine that have been associated with more adverse events and than others, and parents should not allow their children to receive vaccines from such batch of vaccines. Is that true?
It's not true at all. The idea that a certain batch of vaccine is bad is misleading for two reasons. First, there's neither any evidence that linking the vaccinations and the cause of death for the children. Besides, every death suspected of relating to the vaccinations were investigated thoroughly, and they were found they were not related to the vaccine. At most, there were human mistakes, which is they call it problematic error, and they are not faulty vaccine. They are not caused by faulty vaccine. Second, the size of each lots are different. Actually, the longer vaccination batch is in distribution, it is the more adverse events it will be linked to. All vaccination purchased through UNICEF vaccine procurement system all vaccines purchased through UNICEF vaccines procurement system meet World Health Organization requirements and standards.
After this, we will show you guys some videos about vaccination. Let's do it.
In the early part of the last century, hundreds of thousands of people got whooping cough every year. It wasn't always lethal, but it's always miserable. And we figured out a way to solve that. We got a vaccine. We started giving people the vaccine, and sure enough, by the 70s, only about 1,000 people were getting it per year. But it's ticked back up since then, and it's now 15 times what it was in the 1970s. There are a lot of reasons for that, but a big one is that people have just stopped vaccinating their kids. Studies have shown that in areas where a lot of parents don't vaccinate their kids, they're significantly more likely to see outbreaks of things like whooping cough or measles. Measles was officially eradicated in 2000, and yet there have been 288 cases of it so far this year. That's way beyond anything in recent memory, but it's part of a trend. There are a handful of celebrities who have committed themselves to telling people that vaccines, rather than saving lives, are really unsafe.
Vaccines that push children into this neurological downslide, which we call autism.
The doctor who started all this in the late 90s has been thoroughly discredited. He's actually barred from practicing medicine from Britain because he made up his numbers. But that doesn't stop unqualified celebrities from spreading fear. And fear matters. The anti-vaccine body count counted 128,044 vaccine-preventable illnesses, including 1,336 vaccine-preventable deaths in the US since 2007. But in the rest of the world, vaccines have been nothing short of a miracle. According to the Gates Foundation, about 2.5 million lives are saved every year by vaccines. A lot of that is just smallpox alone, which used to kill about 2 million people every year, and today it kills 0 because we vaccinated everyone against it. So when it comes to vaccines, stop listening to the kooks, start looking at the evidence, and just vaccinate your kid.
Have you ever heard any international news that talked about pneumonia? I've never heard. And yet, it is the major killer of children under 5 in this world. If you combine HIV, malaria, and TB, still they don't reach the magnitude of death toll that pneumonia is causing. The funny part is, the vaccine is there. I think it's 10 years now. We have the vaccine in place, and still we're shouting about this disease. So we launched in December 2012, and January 2013, every other child was receiving the vaccine. After the introduction of vaccine, things have changed. In my hospital, we have a diarrhea ward, which used to be full of patients, one bed occupied by more than one child. As I was traveling to US, I left the diarrhea ward with one patient. It's like, what is this? This is like, we've never seen this thing before. One effort of immunization, that is vaccination, can change a lot. And I don't think it's fair for pediatricians in my country and in many other countries to continue seeing children dying from vaccine-preventable diseases. We are living in a global village. We are no longer living in isolation. We want everybody else to take part in this, to contribute to the change, not necessarily financially, but even in terms of putting out the voice. I believe if we do that, if we do just that, we will change the world.